Good day. I am Dr.K Gireesh, physician, neurophysician and neurosurgeon, and on behalf of Padma Clinic and Nursing Home, Chennai, and as a part of the continuing medical education program, as well as a health awareness program for the general public, today's topic will be on what exactly is the pathogenesis of, or how does this occur, low back pain. We see many of them complaining that they have a low back pain, and the commonest one is the disc prolapse. Now let us see what are the types and the variations of pain that occur with the various types of disc prolapse or as a result of the disc. The commonest, it is said, between L4, L5 and L5S1 disc. Before you understand that, I would like you to see this picture. And you see here, this is of the low back. These are the bones. And you see the spinous process. These are the bones. And here you find the nerve fibers are coming out. And then going out actually between the bones. Now, this is the commonest is L4, L5, L5S1. You find L3, L4, L5, S1. We will restrict to this. The commonest disc prolapse are at these particular regions. L3, L4, L5 and S1. Now, between L3 and L4, this is the disc. This blue color is the disc. Between L4 and L5, this is the disc. L5 and S1, this is the disc. It's a cushion-like structure between these two bones, as you see here. Now, with continued strain, you find in the long run, this disc can slowly protrude into the canal, like this. It can protrude into the canal. That's what you see here, the red shade, and also it can occur like this. Now, when it protrudes, it compresses on a nerve root. It produces a pressure on one nerve root, and it is that nerve root which in fact produces the pain. Now, here between L3 and L4, you find the disc will protrude. You will find it compresses the L4 root. Between L4 and L5, if the disc protrudes, it will compress L5 root. L5 is exiting like this. That is the number 1 below. L5 and S1, you find S1 is coming out like this. It will compress on the S1 root, as you see here. So, between L3 and L4, the L4 root is being compressed here. Between L4 and L5, find the L5 root gets compressed. Between L5 and S1, you find the S1 root gets compressed. So, the pain and the muscle weakness and the angle and the jerk loss will exactly be on that particular root distribution. And we will just see each one of these. How does it produce? Now, see it very clearly, this one. I told you here the L3, the L4, L5 and S1. So, between L3 and L4, find the L4 root what is going out, and you see disc comes out and compresses the L4 root. So, between L3 and L4, the L4 root is compressed, and when the L4 root is compressed, the pain will be radiating like this. The pain, paresthesia radiates to the hip, the anterior thigh and the medial aspects of the knee and the calf. This is how the pain radiates for a L3, L4 disc compressing on L4 root. The sensation will be impaired on the medial aspect of the leg. Here is a place where you have sensation reduced. Weakness occurs in the thigh muscle, quadriceps and the hip adductors on this side. The knee, there is a jerk, knee jerk will be diminished. So, this is what happens when an L3, L4 disc compresses an L4 root. It produces pain and paresthesia in the hip, anterior thigh and the medial aspect of the calf. Sensation will be impaired on the medial aspect of the calf. Weakness occurs in the quadriceps, that is the thigh muscles, as well as the hip adductors. The knee jerk will be diminished. This is as far as L4 root when it being compressed. Now, let us see a disc between L4 and L5. You see here the body of L4, L5, and this is the cushion. And when this cushion comes out and compresses the L5, I told you between L4 and L5, the L5 root is going out. So, L5 root gets compressed. When the L5 root gets compressed, you see that the L5 root compression produces pain. It will be the lateral aspect of the thigh, lateral aspect of the leg. Lateral aspect of the leg it goes, and it goes on to the great toe. It goes on to the great toe, second toe and the adjacent skin of the dorsum of the foot. So, it will be going like this. And the weakness occurs in the muscles innervated by those root. It will be in the gluteus medius, tibialis anterior, posterior penorai, and also the extensor hallucis longus. That means the big toe you will find will become weak, the big toe. You will ask him to extend up the big toe, he will not be able to do it in an L5 root compression. The angle jerk is usually normal. So, knee jerk and angle jerk will be normal for this patient. Motor weakness will be the extensor hallucis longus, the big toe will be weak. So, that is the case of an L5 radiculopathy, or L4, L5 compression produces L4, L5 disc prolapse produces L5 root compression. Now, let us see what happens when L5S1, or can say gets L5S1 will compress the S1 root. Now, let us see what happens to that. This is the L5 vertebral body and this is the S1 vertebral body. So, L5, S1, this is the disc and this compresses the S1 root. Now, one number below. So, it compresses the S1 root, and you have the radiation of the pain will be like this on the lateral aspect and on the posterior and going down to the little toe. So, you have a pain radiating to the posterior buttocks, posterior aspect of the calf and lateral toe. That is a classical sciatica, you call it. Sensory loss on the lateral aspect of the foot. On the lateral aspect of the foot, you get the sensory loss, as well as the third and the fourth and fifth toes. Weakness can occur in the gluteus maximus, that is on the back of the buttocks, and the angle jerk is usually diminished. This angle jerk will be diminished. It's very important. So, angle jerk will be diminished. So, S1 root compression occurs when L5 and S1, this particular disc compresses the S1 root. So, it produces a pain which is radiating to the posterior aspect of the buttocks as well as the lateral aspect of leg and lateral aspect of the foot going up to the third and fourth toes. Weakness can occur in the gluteus maximus, especially the hip flexors and plantar flexors. The angle jerk is usually diminished. So, this is are the commonest sides of the compression. One is L3, L4 compressing L4 root, L4, L5 compressing L5 root, and L5, S1 compressing the S1 root. That is indeed, ladies and gentlemen, on the various clinical presentations for a low back pain, and where you can suspect at which level. One of the commonest causes of low back pain is a disc prolapse. Nothing but two vertebral bodies, there is a cushion, and that cushion comes out and presses the root. L3, L4 will compress the L4 root. L4, L5 will compress the L5 root. L5, S1 will compress the S1 root, and accordingly you will find the symptoms, the pain will be there, the muscle weakness will be there, and the jerk of the angle or the knee jerk will be lost. So, this is how you clinically at the bedside you decide, yes, this person is having a disc prolapse and the disc prolapse is at L3, L4 or L4, L5 or L5, S1. And accordingly, you will manage them further with further investigations as well as either medical or surgical management. And when you have such a pain with low back pain radiating in this typical format, kindly see a neurologist or a neurosurgeon. Thank you very much.